Hello again. So let's gonna check a couple of patients that we have usually at my office. This is a woman at the late 60s. He came to my office just asking how to make a facial rejuvenation. And we can realize all the damage that we have for the sun, for the long exposure to the UV rays. You can realize that we have the loose skin, we can have the fine wrinkles too. We have the vascular abnormalities, and we have the irregularity at the pigmentation. So we just decide to make a change in the lower part of the face, especially around the lips. You can see on the fine wrinkles. And so we decide just to use the PDL threads and the skin boosters, and in this case, the Bella Booster, of course. And basically, we just began our treatment, just making a couple points of entry, and we go with the cannula. And with cannula, we initially try to make an improvement in the quality of the skin. So we just go deep under the skin, and we're just trying to use this skin booster just to make a layer under the skin, just to make it smooth, make it a little bit smooth. Use the cannula just to separate these layers under the skin, just to smooth all the fine wrinkles that they will have around the lips. So as you can see in this video, so we just go under the skin, just try to make it smooth. We take advantage of this just to inject some of this of the Vela Booster. And remember, we are trying just to make a massive stimulating, producing collagen and producing elastin. So we are going to use this product just to induce this massive production. So this is the way how we do it. Just take a little bit of the skin booster, just put it in a syringe, uh, just put the PDO thread 2, and just go under the skin in the right layer that we use to use the PDO threads, just to go just on the border of the lip. Just try just to lift the PDO thread, and when we go back, just inject some of this skin booster. So we are just trying just to um, make a line in the border, superior border of the lip. Just we are trying to do mechanically with the thread, and we are doing just stimulating the producing of collagen and elastin, like I said before. So this is another way just to go to cope with the rest of the wrinkles up in the upper lid. The same way, just using the PDO thread, using like a point of entry of the skin booster just to make it smooth the skin under the lips. You can see it what we're doing on the lower lid too, um, the lip, sorry, at the lip, and you are just injecting some Bella Booster too, and just injecting in the same way, just to make and induce all the production of the collagen and elastin. Just remember that all the process of aging is due to the loss of tissues, the loss of collagen, the loss of elastin, the bone reabsorption that we will produce all the changes that we have in all the parts of the face. And it produces all this process of aging around the mouth in the same way. So we are seeing how we do it at the same way on the other side of the mouth, and you can see here how we can use it again. Just fulfill all this tissue volume loss that we have. Just fulfill all the wrinkles. Just use the skin booster just to volumize a little bit the tissues, and at the same time just induce all the production of this massive wave of collagen. This is another way just to find all the wrinkles that we need to treat. Just put it with the needle, We usually use a 30 gauge needle because this procedure produces a little bit of pain. We can see the patient here. We have some shadows, strange shape of the mouth is just the shadow of the film. And now we are trying to make an improvement of all the area around the lateral part of the mouth. And we are trying to volumize a little bit the chin, and we are trying just to improve the double line that we can have of the chin. And it will make the skin booster, it will produce the effect like a volumizer, like I said before. It's similar to hyaluronic acid. We can improve the volume, and at the same time we will improve the quality of the skin. So this is the way we can make a rejuvenation of the lower part of the face. We're trying to combine techniques, use the cannula, use the needle too as well, and just put some skin booster like a biostimulator, and you can use it like a voluminizer too. We are using some volume here just to make the lip bigger, just to make the appearance of the woman in a better way, just to make harmonization of the face, just to improve the shape. You have to remember that the size of the lips will improve the way the people see you. The equal parts of the face will look better if you have a bigger, or according to your face, if you have the right size for your lips. So just don't remember, when we age, we lose volume at the lips. So we need to use some treatment just to make it bigger. So remember here, you're using the cannula, just leaving the subdermal layer just to release all these wrinkles that are attached to the subdermal tissues, and it will improve, it will create like a layer, a substance that will smooth the quality of the skin. It will smooth all these fine wrinkles, so it will be showing a better way, and we will have improvements in the result with the patients. I suggest to the people just to use the PDF phrase, and at least do it 2 or 3 times the treatment. Every month we can do it. We can repeat the use of Bella Booster. We can use it as many times as you want. Just remember that we are using it like a volumizer and skin booster. So this is the result with this patient. It improves, and we are trying just to do it again the next month and the next month. I mean, 2 or 3 times. And I want to show you another case. This is a man in the late 40s. Basically, his concerns related with the deep sulcus that he has under the nose and close to the mouth. We can realize that the sulcus is produced because we have we lost the bone density here, so our tissue just fell down, and of course the lack of collagen and elastin that we lose with the time. So my recommendation to use is to use it again, the combining therapies, PDO threads with the skin boosters, and we have the Bella booster, and in South America we call it diamond fill. And basically we have to fulfill all this space. We have this is the way how you can use it. You just put it in a syringe and just put it the thread, and we are going to the patient, just make a little entry with a needle, and we are going just to fulfill all this area of the wrinkle. You have to release all these connections that you have the wrinkle with the uh, subdermal tissue. We are going just to go in under the nose, just to release all this area. You can see it. And we are going in with a thread, and we are going to try to go out with the thread, just to leaving the thread in this place. Yes, at the same time we are injecting, or we are using the Bella booster just to fulfill this area. We are going back and we're going in again, just to make like something called recanalization of the thread. Just go in, go back, go in, go back again. So we are leave all the thread in that place, just fulfill the area. Just remember, we need to fulfill the volume. We replace the volume that we lost, and we need to stimulate the production of collagen and elastin. This is the way you can see it. We go in and we go back in that way. So it's quite easy just to do it. It just imagine how we can improve our results. Is the way we have to combine all the therapies. We have this, and of course, this patient has a little bit down the mouth too. So I just take advantage of the Bella booster. I just put it subdermal too with the cannula, just to fulfill this area, just to fulfill the wrinkle, just to release all the connections that we have the skin with the subdermal tissues. So I'm just making this way just to fulfill it. Just remember, just to create a smooth layer on the skin. It will make an improvement of the appearance. It will make an improvement of the collagen and the elastin using the right treatment. So this is the way I do it. So you can see it. It's very easy. Is quite easy for the patient. It's not really painful. We don't need a pre-anesthetic preparation of the patient. We're going to do it on the other side of the face, the same way, a little point of entry. We go with a thread. We're going down under the wrinkle of the sulcus. We are going to release all the connections under the skin to the subdermal tissues. We're going in. Sometimes it's a little bit hard just to do it, but with some patience, we can do it really easily. So just go under the nose, and you can go in again. Just leave the thread. Just go back before you leave the skin. You go in again. Just do it a couple of times, just to leave all the thread on the skin, making volume, just to fulfill all the wrinkle. And at the same time, you will have to inject all the substance under this sulcus. So this is the way we can do it, just to improve. We want to see the results. So this is the way to do it again. Use the cannula just to release all the connections and the skin. Use the threads just the way, just to use the Bella booster under. And I use it too in this case, just to fulfill the superficial layers of the skin. So I use this small syringe. I believe that 30 gauge needle, and we use it really subdermal, quite intradermal, just to improve this superficial layer of the skin. So you can use it like a complement of the treatment of the deep sulcus too. It will produce massive collagen. It will hydrate the skin. It will improve the wrinkles and the sulcus. And I just believe this is the best option that we have, just to improve this kind of changes that we have for aging from aging in this patient. So this is my recommendation, just to do it in all these patients, and we will see the results of the patient. It will be really, it will be better, the results. You can see the disappearance of the sulcus. It will improve, and it will improve with the days. So my recommendation is just to do it, just to use the skin buster a couple, 2 or 3 times, once per month. It will be the best treatment that we can offer to our patient.